Hi everyone. So today I want to switch gears and talk about something a lot more serious, and that's the issue of mental health. Today is Bell Let's Talk Day. It's basically a social awareness campaign for the issue of mental health that first started in Canada and now has spread to the United States and to many other countries around the world. It's a very important issue to discuss, mental health, because right now in the United States, we are in the worst sustained decline in our life expectancy since World War I and the Spanish flu pandemic of 1918. During that time, back in the early 1900s, during World War I, the Spanish flu actually killed 50 million people worldwide, and it killed over 675,000 Americans. And it hasn't been since that horrible time of so many deaths, so much despair. It hasn't been since then that we have experienced this level of sustained decline in our life expectancy. Since 2014, our life expectancy has slowly decreased every year, which is unbelievable. We spend more money than any other nation in the world on healthcare. We have the most advanced technology. Everything is improving in terms of sanitation, in terms of the quality of the food that we're able to have, the availability of the food. We have vaccines. We have so many advancements in technology that should make our life expectancy increase, yet it's actually decreasing. And why is that? That's because of the scourge in the decline of our mental health in this country. If you take a look at the top causes of death, it's not increases in heart disease, it's not increases in cancer, it's not increases in stroke that's causing this decline in our life expectancy. Those causes of death have actually leveled off. It is what's driving this decrease in our life expectancy. It's suicide, it's drug overdoses, it's liver disease. All three of them are related to mental health. Suicide obviously from depression, which is one of the most leading killers in the United States. Suicide is absolutely terrible and something we need to address. But also drug overdoses, those are related to mental health because people often use drugs, especially opioids, as an escape from depression, from their life that they want to get away from because of mental health issues. Especially when we have drugs like fentanyl on the market. Fentanyl is one of the most deadly opioids we have in existence because only 2 milligrams of fentanyl, which is just like almost a few grains of table salt, can kill the average person. So the therapeutic dose and the lethal dose is just so close to each other, and it's insane. And then liver disease. So why do I mention liver disease? Since 1999, there has been a 65% increase in the number of deaths from liver cirrhosis in young people. How did they get this liver cirrhosis? It's from drinking alcohol. And what does drinking alcohol have to do with mental health? People often turn to alcohol as an escape from their problems in life. It's all related to this issue of mental health. So we have a serious problem in our country. It's a health epidemic. It's a societal epidemic. It's something that we really need to address. And while there are many different causes for why mental health is in such a crisis in our country, I think one that we can kind of definitively point to is how we use social media. If we think about it, social media, especially the rate and the level that it's being used today and how it dominates our lives, is unprecedented in human civilization. Social media is a relatively new thing for us. If you think about the major social media networks that we use, they were all founded and built relatively recently. So let's take a look at that. Facebook, that was made debuted in 2004. YouTube, that was founded in 2005. Twitter was 2006. And then we have Instagram. That was actually just 2010. Many of us were born before any of these major social networks that we use and that dominate our lives were even made. And so how are we dealing with this new technology and this new community that we're making that's completely, in the cloud and online, and not really, and detached from our day-to-day actual real life. I think we need to be a lot more responsible with how we use it. In particular, there's an epidemic of social media bullying, which is probably causing a lot of this decline in people's mental health. It's using networks like, especially like Twitter or Facebook, Instagram. Bullying others has become almost a pastime for people. It's become like an enjoyable group activity. And this is absolutely disgusting. People gang up with each other in large numbers to target one person in an act of psychological warfare. This happens if you misspeak. This happens if you're falsely accused of anything. This happens without any due process. You're just bullied, and the goal is to destroy not just what you say, but to destroy your life. And when this happens, it creates this epidemic of depression, of mental health issues. Not only for many, like these celebrities have to deal with this, all the time, which really sucks. But it's also spreading to just ordinary American citizens. What really alerted me to this phenomenon is when I saw actual doctors, physicians, sworn to do no harm, sworn to take care of their patients, to be providers of healthcare, to care about human lives. I've had actual doctors ask me to commit suicide. I've had doctors ask me to throw myself over a bridge, to toss myself under a moving bus or a train. And these are doctors who are just, really big on social media. And then they get many other doctors to join in on these attacks. And they're completely baseless too. Once I figured that if doctors are doing this, anybody can do this and become a bully on social media. And this is a huge problem. Something that we need to address, something that I think all the social media networks, the Facebook, Twitter, Instagram, YouTube, we all need to address what's going on here, because this level of bullying is using this new technology of social media that we as human beings have only recently gotten access to. And we need to learn and evolve and change and be more responsible with this. And I think, why don't we actually take a look at some of one of the worst examples of social media bullying that's going on. So let's take a look at that right now. So this is actually from Twitter, and one of them, his name is Dr. Hoser, MD. It's an anonymous Twitter handle, but he's actually a very well-established member of the med Twitter community. And he's a physician, and he says, Dr. Gu has a great future in medicine. Someone sent him a uniform anatomical donor card. He's doing this as a reply to @ThePhoenixMD, @ketamine, and to me. Then underneath him, there's another very anonymous but very vicious social media bully named the Phoenix MD. He's also a doctor, likely from Vanderbilt Hospital. And he says, not sure if he's eligible since the knee is now permanently bent and the scrubs and old white coat have been tattooed on. Also, the ego and delusion may have displaced the viscera far out of anatomical position. Minimal educational value, I'm afraid. And then Hoser MD says, LOL, LOL, good one. These are jokes and laughs at the expense of asking me to kill myself and donate my organs to them, which is absolutely horrendous to hear doctors say publicly on Twitter, while a lot of other doctors laugh about it and support that. I've never seen this before. It's a very weird phenomenon to see doctors who swear to do no harm to actually ask other people to commit suicide. It's horrifying. So here's another one from Twitter involving several physicians. One physician is a Dr. Glaucomflecken. That's his fake name that he goes by. But he's an ophthalmologist working somewhere at some hospital. And he makes a lot of racist jokes. He attacks a lot of chronic pain patients. And he also writes for this medical magazine the satire magazines called Gomer Blog, where a lot of the writers also attack patients, especially those with chronic pain. And they all ask people, they bully people on social media, and they encourage suicide. And then look, one person is complaining against Dr. Glaucom Fleck and saying, why are you attacking? He says, wow, just shove another provider under the bus, why don't you? As a sarcastic remark of saying, why are you bullying others so much on social media? And then Kim T, who's likely a nurse, based on the previous posts that I've seen on Med Twitter, or a physician assistant, says he belongs shoved under a bus, or a train, or a semi. Stalker, creep, liar, just a gross human. So they're inciting violence, and all these people, all these physicians on Twitter are applauding that, which is crazy. So this is probably one of the worst ones. Dr. Teresa Kopecka is replying to Dr. Zubin Damania, who goes by ZDoggMD. He's a pretty influential social media doctor who, ironically, he advocates against the epidemic of suicides in the medical community. Yet he's one of the worst people bullying others on social media, using Twitter, using YouTube, using Instagram, bullying resident physicians and people in training and like basically advocating for people to commit suicide. Look, this is literally under one of his tweets. He never even addresses it. And this Dr. Kopecka says he should bury himself at least 6 feet under, ASAP, walking shame. It shocks people. So another member of the general public was like, a medical professional should never insinuate suicide. You should be ashamed. Really, you should. But I'm sure you're not, because that's the caliber of professional you are. #sad. And then the doctor responds, someone's feeling too superb to skip any expression of his own, quote, intellectual level. I don't even understand what that means, but it's pretty ridiculous. And then the response was, I'm not a physician wishing someone dead. You don't have to be smart to understand how mean and inhuman that is. And it's just unbelievable that several doctors speaking underneath, in reply to a bullying tweet by Dr. Zubin Damania, can advocate suicide. It's just, I've never seen this before throughout all of my medical training, and it's only recently on Twitter and on social media that I've seen doctors basically turn into monsters who violate their Hippocratic oath. And it's scary to think that these doctors actually have their own patients and deal with human lives when they go home, they go on their computers, they go on their phone, and they try to ask people to commit suicide. It's very tragic. And those are just a few examples. There are many other doctors on social media. In particular, there's a Dr. Jennifer Gunter who goes on very lengthy tirades and bullying campaigns against ordinary people. Using her platform, she has over 100,000 followers, using that to just attack people and promote false accusations. It's been an extremely crazy place on social media recently because of these doctors who go and advocate for suicide, incite violence. I can't even believe that I have to even talk about this, because I never once in my entire life thought that doctors would ever be capable of doing stuff like this. And if doctors are capable of doing this, anybody is capable of doing this. Social media bullying has reached epidemic proportions right now. And it's something that has to stop immediately. And I implore you, especially if you're a physician, don't go on social media and ask people to commit suicide. Don't try to ruin people's mental health like this. Like, it's just unconscionable for a medical professional to do this. And if you're an ordinary American citizen, just think before you tweet, think before you post on Facebook or Instagram about the person that you are attacking. If you're attacking someone, that's a human being who has feelings, that's a human being who deserves to have every right for the pursuit of happiness and to live his or her life without fear of having complete strangers gang up together to destroy a single person. So I hope we can all think about all of this, especially on Bell Let's Talk Day. Think about mental health, think about being better people, both for ourselves and for others. Because this is a serious issue, and we have to not only address it, but we have to fix this and we have to change for the better. Thank you guys for listening, and hope to see you guys next time. Bye.